Welcome everyone to this sensational Saturday where we talk about post-COVID fatigue and role of L-Carnitine. We have two stalwarts on board who are going to navigate through this very treacherous topic, something that is very relevant now. First, let me introduce today's moderator, Dr. Amit Saraf, who is an MD FRCP, FICP, FACP, and FCPS, Director, Department of Internal Medicine, Jupiter Hospital, Mumbai. He is also the head quality control, the same hospital, international advisor for the Royal College of Physicians, London, reviewer for BMJ and the Annals of Internal Medicine, MRCP London examiner, DNB teacher, and an MD examiner. He's also the National API Governing Council member. And all these credentials don't do him justice to the amount of experience that he has. I welcome Dr. Amit Saraf to today's program, and I request him to kindly take the proceedings ahead and introduce today's speaker.
Thank you, Shasan. It's a pleasure to be here on a Saturday evening. I would firstly compliment Recharge and Shasan and the entire team for bringing forth an extremely relevant topic in the present times. My esteemed speaker, who I will be introducing in just a minute, all the doctors who are our delegates, all the the people who've logged in this evening, have spent the last 18 months fighting COVID and the impact on their lives, their patients' life. We know that this has changed our lifestyle. We know COVID has brought about a new normal, which we are still fighting. There's a third wave on the doorstep, which will come in, and that apprehension is looming over our heads. We have been dealing as doctors with the common post-COVID complications, and the patients are suffering. And suddenly, when everything was maybe we discovered a few drugs working towards COVID, we discovered a few cocktails of MAB antibodies working towards COVID. And suddenly now we're talking about an entity which is long COVID, which has caught the world unaware. People who've had COVID in 2020, almost 6 months to 8 months prior, even today come and complain to us with these symptoms. So to address this, we have a gentleman today who, other than a doctor and an astute academician, clinician, I would also say has been a COVID survivor. He's been there. He's fought COVID, won through COVID, and emerged as a real hero in the entire process. I think it's made him much more stronger. I think it's made him much more humane to the fellow COVID patients who is treated post that. And I have the privilege and the pleasure to introduce Dr. Mangesh Tivaskar, who is an MD FRCP from all the four Royal Colleges of UK, also a fellow of the American College, the Indian College, FGSI, Diploma in Advanced Diabetology from Denmark, consultant physician and diabetologist at the Shilpa Medical Research Center in Mumbai. He's a gold medalist at MD at MBBS for the subjects of biochemistry, pathology, microbiology, and pharmacology, which over the years has been reflecting in his practice. I have seen him talk about drugs, is the biochemistry, the basic sciences, absolutely with the same knowledge and enthusiasm as an MBBS student and beyond. He's the Honorary General Secretary of the National API, ACP, and PRF, on the editorial board of JAPI, Medicine Update, and the IJD. He's on the governing body of the West Zone representative for the ACP in the Indian chapter, guest editor in the Insulite Journal and the World Journal of Anemia. He's delivered more than 1,000 amazing lectures. He's a phenomenal orator at national and international conferences, multiple chapters, publications, poster presentations, write-ups, and textbooks, peer-reviewed journals, international platform. And I think one more to be added here, an MRCP examiner from the center of Jupiter Hospital, one of the inception examiners, one of the examiners who was shoulder to shoulder with me and the team Jupiter to build up the center as one of the first spaces centers in the western part of the country. So I welcome Dr. Mangesh Tivaskar to elaborate and talk to us on a topic, post-COVID fatigue and the role of L-Carnitine. Over to you, Dr. Mangesh Tivaskar, please.
Well, thank you, Amit. It's always a privilege and a pleasure to get introduced. And I know that there is always a personal touch of love and affection that you have for me. And I'm really truly touched with all those lovely words. And good evening, friends. Thank you very much, session. And of course, the entire team Alkem for giving me this opportunity to talk to you about one of the unique topics. And why I like to, share with you why I chosen to speak on this topic primarily is because, we know that, as Amit has really rightly pointed out, that we we are probably in a post-COVID phase. Everybody of us, those who have gone through it, they are very well aware that there is something called as a post-COVID situation. And we also had explored so many therapeutic modalities while managing COVID. Forget about post-COVID situation, but even during COVID. And few of them were even nutraceuticals, micronutrients, microelements. We all tried that in a quest to achieve and conquer this menace. But what has really stood its time is this molecule, L-carnitine. Unfortunately, did not get that limelight. But I can tell you that, once you understand about L-carnitine and the role it plays entirely in a human body, no matter in a disease situation or even in the normal human physiology, you'll be really mesmerized to understand this. So let's talk a bit about L-carnitine in role to play in post-COVID scenario, especially post-COVID fatigue. What is its mechanism of action? And also we'll try and discuss not only about L-carnitine, but also we'll try and talk to discuss with each other about the other two, probably one of the important vitamins, that is methylcobalamin and folic acid. Before I do that, probably I wish you all a very happy Raksha Bandhan coming tomorrow. And of course, a very happy Onam to all the South Indian people and entire India and have a very, very blessed and a very happy festival day tomorrow. Now we know that this is even though the 4th August 2021 data, but overall it has not changed, fortunately, for last probably couple of weeks. Around more than 200 million global cases, witnessing around 4.2 million loss of lives. In Indian scenario, we definitely have more than 32 million cases, and we definitely have lost more than 400,000 lives. If you really calculate in the deaths per minute, you'll be surprised to find out that even though such a minor and a very small virus, but the amount of the damage that it has caused is this if you can understand the mortality, that 1 minute, if you really consider COVID to be kicked off in India from probably, March or April last year, you'll realize that 1 minute has costed probably 5 lives of the patient, those who had. But what is more important is we discussed a lot with a great intensity about the management protocols, the different therapeutic options as far as COVID situation is concerned. What is most mesmerizing to understand that, unfortunately, with the same intensity, we could not follow up the management of the post-COVID scenario. And remember that it is one of the most important things that you need to understand. Pathophysiology of the COVID, I'm not going to go into the details. A virus enters the body through, we all popularly know that it's interaction of the spike protein with ACE2 receptors and ultimately causing a cellular damage by 3 mechanisms. We know number 1 is triggering the local inflammatory response, second triggering the systemic inflammatory response, and thirdly the coagulopathy, which ultimately causes the complications and all the damages related to COVID. And the most important damage that happens is the damage to the cellular energy metabolism. It is the damage to the DNA. It is the damage to the mitochondria of the cell, which actually makes people vulnerable for development of what we call it as a post-COVID syndrome. There are so many other mechanisms which are thought about to lead to post-COVID syndrome. So what we understand by post-COVID syndrome? Now we have to know that post-COVID syndrome are like persistence of the COVID-like symptoms, even though the patient once turns COVID negative, tests negative for the SARS-CoV through RT-PCR, but still continues to harbor the symptoms of COVID-like situation after probably 9th or 10th day of the recovery. Slowly, this patient starts entering to what we call it as a post-COVID phase. And this is actually a definition. Remember that there is no classical definition for the post-COVID scenario. But this is what the definition is thought about. Now, it has got 2 different phases. One is the near, I would say a short post-COVID phase, and then the long post-COVID syndrome, what we know. Short means the phase between 4 to 12 weeks, that is around 1 to 3 months. And if the symptoms persist after 3 months, then we really call it as a long COVID syndrome. Now, remember that whenever you label somebody to have a post-COVID syndrome, you need to always remember that you have to rule out the onset or the kickoff of a new disease in this patient, which could be responsible for those symptoms. So, what are the common, I would say, presentations of the prolonged symptoms? This is what is true, that 1 in every 5 people infected with COVID will experience some kind of the symptom persistence. And what are the commonest symptoms? The commonest symptom is fatigue. A huge number of patients, nearly around 60% of the patients, will experience fatigue. Remember that post-COVID symptoms can be multisystemic. Almost all the systems are involved. But the commonest ones is fatigue, breathlessness, persistent loss of smell, persistent cough, and in some scenarios, you'll definitely get muscle aches and pains, lack of zest. And of course, apart from these systemic symptoms, naturally, there are so many of psychological or the psychosomatic disruptions happen. So this is the burden of the post-COVID symptoms that you're seeing on your slide. And easily you can see whether they are hospitalized patients or the patients, those who are on OPD. The commonest symptom that you are seeing here is fatigue. Around 60% of the people are bound to experience, and this fatigue persists. And remember that fatigue is one thing which makes you to really feel sick. You still feel that you are continuing to be sick, even in spite of the fact that you are completely recovered of the disease. But that feeling of sickness, that feeling of malaise, that feeling of lack of zest, the feeling of lack of enthusiasm persists. So this is the analysis of around, say, 2,000 patients, those who were hospitalized because of the COVID in last around, say, 18 months or period of time of an acute illness. Look at this. So many number of patients, 63% patients, they had fatigue or muscle weakness. Apart from dyspnea, sleeping difficulties, anxiety, depression, as we talked about, hair loss. You can see I have lost around 50% of the hair after this post-COVID recovery phase. Why it is important? Because you need to have effective strategies to actually combat this post-COVID challenges. So what is most important thing is that you need to understand, this is what I told you, that it is a multisystemic disease. It involves almost all the organs, right from the neurological system, the gastrointestinal system, to the skeletal system. Every organ is involved, and they can be a chronic fatigue syndrome like presentation. And that's what is the most prominent feature of COVID, that is chronic fatigue syndrome. And unfortunately, on the top of it, if the nutritional deficiencies or these micronutrient deficiencies are added, then you are likely to get hit with this chronic fatigue syndrome very well. Most importantly, the patient, those who have been diagnosed to have severe, moderate to severe COVID, or those who required a long ICU stays or hospitalization, they are more vulnerable and more likely to develop chronic fatigue syndrome secondary to the COVID. And the commonest deficiencies we know are vitamin C deficiency, the complex challenges, zinc issues we have already, but one such prominent, I would say, dipeptide deficiency, which hardly has been talked about, which hardly has been discussed about, and that is the reason why I'm so excited to talk about this, is L-Carnitine deficiency. So let's find out the role of L-Carnitine in the post-COVID. And what do you understand? What is this L-Carnitine? I'll take you back to your MBBS days, where you are learning biochemistry. And I'm sure that many of you must have forgotten about this. But this L-Carnitine is a dipeptide, a quaternary ammonium compound. Quaternary means at the fourth place, there is an ammonium radical there, and a compound which has got 2 amino acids. So it requires 2 amino acids, lysine and methionine, for the manufacturing, for the synthesis, and it gets synthesized in the liver. Now, why L-Carnitine is necessary? Now, I'll tell you a brief about the physiology of L-Carnitine and why it is important. Now, I hope you remember that the generation of the energy into the cells happens in the mitochondria, right? Mitochondria are the powerhouse of the energy generation, correct? Where you know that ATP is converted to ADP and AMP, and these phosphate bonds, these high intensity phosphate bond, they get hydrolyzed and release around 7.4 kilocalories after the breakage of each phosphate bond. And that's how when ATP breaks down, then with leaving adenosine and getting three phosphates molecule hydrolyzed, you will get, after the breakage of an ATP, you get around 14.6 or 15.6, I would say 7.4 and 7.4, so 14.8 or 15.6, roughly around that kind of an energy of ATP release or a kilocalorie release once you get. Now this happens in each cell in the mitochondria. Now, how do you get this energy? From where you get this ATP, there is something called as a beta oxidation happening there. Now, what is this beta oxidation? It is a process of oxidation by which the long chain fatty acids, long chain essential fatty acids. You remember there are 4 long chain essential fatty acids. 4 can be easily remembered by a mnemonic which was taught to by my father. He said that, how do you remember this long chain essential fatty acids? By a mnemonic called as LMPS, lauric, myristic, palmitic, stearic. So these are all 4 long chain. Long chain means the amino acid, the fatty acids, they are long chain. The carbon molecules are more than 17 or 18 carbon rings which are there. So these are all long chain. See, the short chain fatty acids and the medium chain fatty acids can easily run it in and out through mitochondrial membrane. But long chain fatty acids, which actually serve as a source of energy when ATP is converted into ADP and AMP, they cannot just pass through the mitochondrial membrane easily. So to carry them from outside mitochondria to the inside mitochondrial matrix, you need a shuttle service. You need a carrier service. And it is this L-Carnitine which actually serves to carry this, long chain fatty acids from the outside membrane of mitochondria. Once these fatty acids, they reach the cell, fatty acids, as we know, are stored in adipose tissue. And in adipose tissue, they get stored in the form of triglycerides, like a glycerol backbone and the 3 fatty acids attached to a compound and a compacted form of fatty acid storage in an adipose tissue is what we know as triglycerides. Now, these triglycerides are broken down with the process of hydroxylation again. And once this happens, the glycerol compound gets separated out, the glycerol backbone gets separated out, and 3 fatty acid chains are released. Now, these chains are carried by that alkane inside the cells, and from inside the cells, the way from the inside the cell matrix to the mitochondrial matrix, it is carried out by L-Carnitine, which is a dipeptide synthesized by 2 amino acids in liver, lysine and methionine. So this is overall why L-Carnitine is important. So L-Carnitine is necessary for the energy genesis, to keep the cell metabolism, and that is the reason why AMP phosphokinase or AMP phosphatase, which is called as a switch on and switch off mechanism. This is how the AMP phosphokinase and AMP kinase works, where you need to understand that it is this AMP kinase which actually breaks down ATP to give you energy. And it is this ATP which gets formed from the long chain fatty acids entering into the mitochondrial matrix by a shuttle transport mechanism. This is in brief about L-Carnitine, you understand. And remember that L-Carnitine becomes deficient in these patients of chronic fatigue syndrome. And whether it is, I would say, there are 2 different types of L-Carnitine, ALC and PLC. I'm not going to go into the details about it, but no matter, it could be a general fatigue or a physical fatigue or a mental fatigue, you will realize that, in all these scenarios, you can find out that L-Carnitine becomes deficient. And this is a study which has shown in a chronic fatigue syndrome that how L-Carnitine deficiency affects your somatization, your perseverance, your depression, your anxiety, GC1 score, or the physical abilities or mental abilities, how they are affected is definitely demonstrated in this beautiful study. So what are the potential benefits of L-carnitine therapy? It not only has got an energy genesis effect, but also it has got an effect as far as the antioxidants are concerned. Because remember that L-carnitine synthesis requires the presence of vitamin C. It requires the presence of ferrous form of iron. It requires the presence of pyridoxine. It requires the presence of the other protein molecules, additionally other micronutrients like selenium to have the synthesis of L-carnitine. So it has got an antioxidant effect. It has got an anti-apoptotic effect. So as being an antioxidant, it serves as an anti-inflammatory. It also has got immunomodulatory effect as a vitamin C has, and it has got a role to play to bow down or to I would say curb the cytokine storm by inhibiting the interleukin 6 and interleukin 1 levels. It has also an inhibitory effect on TNF alpha. It also inhibits what we know as the vascular smooth muscle proliferation. It also downregulates the reactive oxygen species, which is actually responsible for inflicting the mitochondrial and the genetic damage or a DNA damage, acting through the PPAR receptors. So this is whole way how the L-carnitine is important and how treatment with L-carnitine actually inhibits the viral induced cardiovascular damage or the systemic damage is beautifully illustrated on this slide, where you can see that it upregulates the nitrous oxide synthetase, and that's how it reduces down the reactive oxygen species. But also it becomes a free radical scavenger. It reduces down the fatty acid peroxidation, which will make these fatty acids ineffective of generating the energy. And the amount of, rather than L-carnitine I would say inaction, sometimes because of this toxic acyl CoA, sometimes this ATP formation, because we all know that acetyl CoA is a basis for the ATP formation in the beta oxidation, and this acetyl CoA in a wrong form can get converted in the presence of not L-carnitine, but there is something called as a D-carnitine, because remember that carnitine exists in two forms. The enantiomer of carnitine is L-carnitine and D-carnitine, dextrocarnitine and levocarnitine. That's what we know about. So overall, carnitine has got a beautiful cardioprotective effect. As we talked about, we all know that COVID has got a tendency to inflict myocardial damages. It causes myocarditis. It induces the arrhythmias, and that is how probably L-carnitine might serve the cardioprotective effect when they are administered in the patients of post-COVID syndrome by preventing the myocardial injury. They reduce down the endothelial dysfunction. They reduce down, or probably they actually I would say inhibit the hyperimmune response or adverse immune response, and also they'll stop medications causing an effect like prolongation. We all know that QT prolongation can be because of a whole lot of medications, and especially antivirals, and to a certain extent the monoclonal antibodies can cause QT prolongation. So in this scenario, probably L-carnitine therapy works beautifully well. I'll not go into the details about the other additional benefits, especially in the SARS-CoV-2. But remember that L-carnitine pre-treated patients were doing definitely better as far as the recovery from muscle weakness, or even to certain extent lung injury, or to certain extent the inflammation-related injury in the patients of COVID or the other viral infection. There's a whole of the mechanisms, and look at this: the antioxidant effect, the anti-apoptotic effect, the genome stabilizing effect, the immunomodulatory effect, the cardioprotective effect, all which are actually responsible for inflicting damage in COVID are fairly well countered by L-carnitine. Quickly talk about methylcobalamin and its role in recovery, as L-carnitine is very important. And remember that the dose of L-carnitine, which is usually substituted, is anywhere in the range of 500 to 1000 milligrams 3 times in a day. One of the most beautiful therapies. And now we do have a combination of L-carnitine with various other vitamins like vitamin B12 or mecanolamine. By the way, friends, it will be really funny to know about it, that L-carnitine was first discovered in 1905. And that time, when actually the studies they have started, the research happened, the L-carnitine was initially thought to be one of the vitamin B complexes, and it was also labeled as vitamin BT, short T, and that's what it was initially labeled. But then over a period of time, people have realized that it is not a vitamin, probably it is an L-carnitine as a molecule. So Along with L-carnitine, vitamin B12 or methylcobalamin or mecobalamin also plays an extremely important role. We all know that because it also has got a role to play as far as the improvement in the gut microbiota. Remember that COVID has got a tendency to disrupt the gut microbiota and cause a lot of intestinal symptoms. So if there is a presence of B12 deficiency, there can be a challenges, and we all know apart from the COVID situation, the associated comorbidities like diabetes, obesity, hyperhomocystinemia, they have a feature of having a B12 deficiency, which actually will cause what? It will worsen the viral proliferation. It will increase the viral multiplication, which will lead to higher and potent action of the virus, and will have an uncontrolled hyperimmune inflammatory response through various other mechanisms and can cause poor outcomes in COVID. So there is a huge amount of evidence, it has been already there, that supplementation of these patients along with the therapy with these micronutrients, minerals, vitamins definitely improves the post-COVID phase. And usually mecobalamin in a dose of around 500 to 1500 micrograms to you can go up to 3000 micrograms daily can really beautifully help this patient. Same way, folic acid also has to play the role. We all know folic acid has been one of the vitamins which unfortunately did not get an attention. It was again in those 1930s period when the role of folic acid. Why? Because homocysteine was responsible for causing acute atherosclerotic challenges. And now you know that hyperhomocystinemia is one of the prominent reasons, the single most important factor for increase in the atherosclerotic cardiovascular disease and the vascular plaques. And folic acid is one drug which inhibits this homocysteine and will protect. And not only that, folic acid also inhibits furin, which we all know is one of the responsible proteins which has got a role to play as far as the binding is concerned. Because through this furin and TMPRS22 that trans membrane protein series amino acid, which makes this spike protein to bind to ACE2 receptors. Folic acid beautifully binds to this furin and stops the replication and attachment of the virus to the ACE2 receptors. We all know various sources of folic acid. It's available in tetrahydrofolic acid form and 5-methyl tetrahydrofolic acid forms, and they are easily can be replaced. So if you really look finally, the benefits of combination of L-carnitine, methylcobalamin, folic acid in the supplementation as far as the COVID, intra-COVID, but not only intra-COVID, but post-COVID phase, you'll see that L-carnitine plays a role in reducing down the oxidative stress. It abates the cytokine storm. It reduces down the myocardial injury. It stabilizes the endothelium. And not only that, it has got an immense power to regulate and regenerate the DNA damage which happens following the post-COVID, and also is responsible for a good cellular energy generation and metabolism. Apart from that, mecobalamin, you all know it has got an ability along with folic acid to stop viral replication. It reduces the cytokine related cellular damages, and also has got an ability to reduce down the reactive oxygen stress. So with this, I hope that I have tried to give you a brief, I would say, overview of these three important nutraceuticals. And with this, I would be very happy to answer any questions if I have not confused you adequately. Thank you very much. Over to you, Amit.
Devaskar, as always, eloquent, to the point, concise, and I am sure you've made your father proud today. The late Professor Dr. Devaskar was a professor of biochemistry, and I think in Sir's talks today, I think that that early age where he must have imbibed the principles of biochemistry and the earlier science of medicine, Sir, I think portrayed very, very astutely in today's talk. That that grasp, you hardly had to look at the slides when you were talking about L-carnitine and at the molecular level, how does the ATP form and 7.4 kilocalories. Beautiful, so wonderful. I think there are a lot of questions, but I'm sure you've already answered a lot of them. So with Sir's permission, I would want to take on a few questions to begin, and I would request all delegates to please type in the questions in the chat box. Let's try to have as interactive a session as possible. So, yes. Sir, you've answered a lot of these questions, but I think for maybe a little of repetition purposes, A lot of questions have come on the dose of L-carnitine and the dose of vitamin B12, please.
Yeah, so that's what L-carnitine is available in the preparations of 500. I unfortunately did not talk about. I would say what is the natural source. Remember that naturally also we can get L-carnitine, but for those who are non-veg eaters, non-vegetarians, the source is usually the muscle meat. Especially the red meat is a beautiful source of L-carnitine. But remember that it is this naturally existing L-carnitine is not a ready source. It needs to be again metabolized and reconverted into a circulating L-carnitine. You cannot have L-carnitine just directly from the meat source. But for vegetarians, unfortunately, you do not have too many good sources as far as L-carnitine is concerned. And the dose is usually around 500 to 1000 milligrams, even in a dose of around twice or thrice in a day, depending on the situation and challenges. But do not cross 3000 milligrams at one time. And you can continue it over a period of around 3 to 6 months, depending on the symptomatic recovery of the patient.
Thank you, sir. I think that satisfies Dr. Dipankar Das, Dr. Kiran Patiwar, and Dr. G.S. Tripathi's question. Dr. Sagar Hirani from Junagadh is asking, can these two be given together, role of B12 along with L-carnitine?
Yeah, in fact, they are available as the fixed dose combinations as well. And probably, I don't know whether Alkane has this combination or not, but there are quite a few combinations which are available with L-carnitine, methylcobalamin, and folic acid together. So you can give them together. If not, possibly, in combination, you can give them separately, fairly fine. So we all know folic acid and methylcobalamin combinations are available, and you can also give L-carnitine.
Thank you, sir. Dr. Dharmendra Singh from Gorakhpur is asking a bit. I mean, I would. It's a good question. He's saying that L-carnitine's role in the physical aspect has been proven through all the slides and your talk. Yes. He's asking, is there a role in the psychological aspect of this molecule in the patient?
Phenomenal.
Or it's only counseling which is advocated?
No. Very good question. This was Dr. Dharmendra, right?
Dharmendra Singh from Gorakhpur.
Yeah, Dr. Dharmendra, I appreciate your question, and it is a good thought process that you are going. And remember that, see, whatever affects your basic cellular metabolism will also have an impact as far as the psychological outcome. See, remember that mind and body, they go hand in hand together. To have, as we know that, as we have that feeling of well-being. See, suppose your cellular energy is low and down. Imagine how you are going to feel, as far as your mind attitude. You cannot keep on pressurizing your systems, if you have got an unhealthy body. Unhealthy body cannot have a healthy mind, right? Similarly, unhealthy mind cannot, drive the healthy body. So these two go together. So even though there are no direct studies or the data which are published as far as the role of psychological impact, and yes, but in the first slide, if I have shown you correctly, there were some studies which looked at even the psychological and the various scorings which they did in that slide. They surely have shown that it does have got an effect as far as the recovery from depression, from anxiety, from panic disorders, from that I would say listless or zestless feeling. All these things. And in fact, the quality of sleep, which is again one of the prominent features of the post-COVID syndrome, has improved. So I would say that it may be a recovery or a repair base happening at the cellular level, but it does have an effect as far as the psychological outcomes are concerned also.
Thank you, sir. I think the sense of well-being is what sir is, has very rightly said, is given back to the patient. Dr. Rahel Morardia from Ahmedabad and Dr. Anuj Jaiswal from Gorakhpur almost have a similar query, that we've talked about the therapy of weakness of post-COVID. What is the main cause they both would want to know of the weakness after COVID? We've talked about therapy.
So this is what
is the main cause?
This is what we exactly talked about. Now it all boils down to the cellular energy metabolism. This is what we exactly talked about, and that is the reason why I gave you an overview of what exactly happens. See, remember that COVID virus and all these inflammatory cytokines, along with an excessive reactive oxygen overload or oxidation occurring, causes a lot of mitochondrial as well as genetic disruption. And the mitochondrial energy synthesis and the energy handling at each individual cellular level suffers a huge amount of barrage. And that is the reason why, you know, it even though it sounds very funny, but I'll tell you, we did not discuss a role of an adequate nutraceuticals in the patients of not only COVID but any long disease convalescence. They will all require these kinds of supportive nutraceutical support. Why? Basically because ultimately it boils down to the cellular energy handling, and that is the thing which is most important, decides about the survival and the energy genesis, right? So it is very important to understand that it's not only, you know, I would say the symptomatic recovery, but it also is a cellular recovery, which is very, very important. And to keep that energy metabolism going normally as you get in health, which is disrupted in the disease because of the excessive inflammatory response and actually all those barrages that are happening. These are the areas where probably these nutraceuticals and even like vitamin C, zinc, we talked about, phenomenal. They have a beautiful immunomodulatory effect. We all know that vitamin C, which is necessary for L-carnitine synthesis, has also a role to play in innate immunity. It has got a role to play in actually quietening down this cytotoxic CD8 cells, which gets overexcited because of the abnormal stimulation coming through the CD4 helper cells. And why that happens? That happens because it is that interleukin 6 which is triggering this excessive CD4 phenomena. And the CD4 will keep on activating this CD8 cells. Remember that, you know, you have got two different phases of immunity: innate immunity, which contains all the cells, mostly the granulocytes, the monocytes, and the natural killer cells. And also you have got a humoral immunity, or what we also call as acquired immunity, where you have got antibodies and then these T lymphocytes and B lymphocytes, which are responsible for conferring you that. And it is this CD4, CD8 work together either can save you or are responsible to kill you as well if malhandled. That is what is most important. So we have got an AK-47 in your hand. Now where to, you know, shoot it, it's entirely the way you manage your patients.
Wonderful. So very well put. I think extremely well, very well put, sir. Another very good question has been asked. So we spoke about the post-COVID complication. We saw about long COVID and the therapy. Somebody wants to know that, is this all the post-COVID, long COVID, will that be a little lower in incidence and even the time period in a post-vaccinated population?
It is definitely. See, remember that vaccines are definitely beneficial because it prepares your immune system to handle this, viral related toxemia and damages very well. Why vaccines are important is because it makes your immune system ready for the further onslaught, both innate and the acquired immunity. Both will become ready once you vaccinate. So better preparedness, again, the same thing. You know, vaccines will only give you the better preparedness. Vaccine will not stop you from getting the disease, but vaccine will definitely change the way your system can handle the disease. This is very important. So I always give an example of Amit to everybody when it comes to vaccination. You know, vaccines are like seat belts of the car or the airbags in the car. They will not stop you from getting accidents. But if at all in a case of emergency, if at all you get, hit or, if you land up into accident, then there is a chance that because they are there, you will be better protected and the possibility of damage minimized.
Great, sir. Again, very well answered. I'm sure you answered this question, sir, but I would just want it to be re-answered. Somebody's asking, is an upper limit dose of 3,000 micrograms of methylcobalamin per day safe in a post-COVID fatigue?
Yeah, fairly safe. Remember that these are all water-soluble vitamins, so don't worry about it. You would have heard about, lipid-soluble or lipophilic vitamins and hydrophilic or water-soluble vitamins will have got a different way of metabolism. Lipid-soluble vitamins or fat-soluble vitamins, they will have a tendency to stay back for a longer time. So you may get easily the toxicity effects in this patient. So look at vitamin D. You can get hypervitaminosis. You can get hypervitaminosis A. You can get hypervitaminosis E, which can cause challenges. But you will not get hypervitaminosis B so easily. because this is a water soluble vitamin and it will easily get excreted through the kidney. So don't worry about it. You will, and quite a few of my patients, they ask, whenever they do their vitamin B12 levels, sir, my vitamin B12 levels are more than 2000. Shall I stop? I said, no problems. Don't worry about it. You don't have to stop it. Your body will automatically take care of whatever is the excess. So don't worry about it. So even though you have reached the metabolism dose of 3000 micrograms also, don't worry about it. They will not be causing any damage. They will be taking. Body will only keep whatever is necessary. Rest of them is going to be also, remember that will be thrown off. So don't worry about it. We do not have vitamin B stores in our body. Yeah, of course, we can store to certain extent in liver and in the peripheral muscles, but not to that extent. So remember that. It's not necessary to be really worried about for. But don't trust that much of those. You don't require so much of those. And 1500 to 2000 is quite all right.
Okay. Sir, another question has been asked on the role of L-carnitine in something beyond COVID. We spoke about the role of L-carnitine.
Yeah, in fact, beautiful question. Nice,
just
nice.
in simple fatigue, can it be still
given? It is not only in simple fatigue. There are so many endocrine disorders. I mean, like look at diabetes, look at obesity, look at cancers. Even male, you talk to orthopedicians, they are giving L-carnitine for the joint health. You talk to cardiologists, they are giving this L-carnitine for the better vascular health. You talk to obstetrician and gynecologists. It's one of the therapies for male infertility. In chronic fatigue syndrome, even in psychiatric patients, in the patient those are chronic depressions, chronic or even schizophrenia, these patients have done very well with L-carnitine. So it's not just while disease convalescence or something like that. And actually, of course, in all convalescence, whenever there is a cellular energy at jeopardy, you need to restore it. And whatever the mechanisms that you have to restore this bettering of the cellular energy output will ultimately improve the cellular health. And once the cellular health is better, the energy handling becomes better. The overall fatigue and the general health becomes better.
So we spoke about the role of all these micronutrients, methylcobalamin, folic acid, and L-carnitine in the fatigue aspect. Somebody wants to know the role of all of these, especially now that we are seeing patients of lung fibrosis. So in that post-COVID convalescence of lung,
do they have a role? Absolutely, very well said. In COPDs, in smokers, in even recovery from the acute lung injury, or bettering, or even in the fibrosis, even though you don't have a direct data to prove it, but surely this is again a process of healing, right? I mean,
yes.
So wherever there is a healing happening, you will need this for the better repair process, isn't it?
Yes.
And especially patients with COVID, patients with diabetes, patients with hypertension, even in the chronic diseases, all these people will surely get benefit. Very well, very, very important.
Dr. Anupama Sinha from Bhagalpur in Bihar is wanting to know how can one overcome a muscle pain issue after COVID?
Yeah, so this is one very difficult thing. And of course, apart from the good nutraceutical support that we discussed, surely we can try on, some, there are two or three ways you can try some NSAIDs in some situations, or even to certain extent, even metabolism plays a very good role apart from L-carnitine in recovery. Vitamin C, vitamin and zinc plays a very important role there. But also remember that for this muscle health recovery, sometimes you need to also pay attention to the little nerves, and then probably their SSRIs like nortriptyline or amitriptyline can play a better role along with gabapentin. To small doses of gabapentin can also definitely be helpful in managing these patients.
Great. So that is answering Dr. Anupama and Dr. Amiya Swain from Cuttack Orisa's questions as well. Dr. Waliul Islam from Kolkata, West Bengal is asking, and this is a question, sir, repeatedly asked by a lot of people. People want to know how long can you just continue with L-carnitine? Is it patient specific? Is it a time period?
Usually if you stay simple, I usually say that as long as you feel sick, or as long as you feel, you stay symptomatic. See, you cannot actually define the dose. It is completely individualized there. Somebody recovers within 2 weeks' time, fairly fine. You have got a reason to stop 2 weeks' time and keep the patient under observation. But overall, usually it has been observed that it is not required for more than 6 months of period. You don't have to continue. Ideally, 3 months, probably 6 weeks to 3 months, 6 to 12 weeks, and don't cross more than 6 months of time. It will not be of interest.
Okay. Sir, I mean, at this point, I would want to say this that you have addressed the concerns of around 6,000 attending delegates who've logged in this
Wow.
evening for this
Wow.
wonderful
Thank you.
topic.
Thank you.
And I would encourage anybody also if they have any more questions, because we've finished the ones in the chat box and Dr. Tevaskar is here for a few more minutes. If anybody has any questions, can please ask. But I think, sir, it was a phenomenal talk. I think you've covered a lot of aspects, varied aspects from everything. A question has just popped in. You've covered this, sir, but people just in general want to know the diet for these three put together. All of them, the folic
Yeah,
acid,
so
L-carnitine, and methylcobalamin.
So usually non-vegetarians are blessed if they love red meat, especially the skeletal meat is a very phenomenal good source of L-carnitine. Liver meat is also a good source of L-carnitine. But unfortunately, vegetarians they do not have too many of choices. Probably cabbage, to a certain extent cauliflower, to a certain extent some green leafy vegetables. Cereals unfortunately do not have too much of L-carnitine. So these patients, especially vegetarians, will require always an additional, pharmaceutical source to look at as far as the L-carnitine is concerned. And very interestingly, Amit, in the patients of alcoholic liver disease, in the patients with chronic liver disease, in the patients of chronic kidney disease, in the patients who have undergone transplants, in the neurological challenges like Alzheimer's or dementia, there also L-carnitine has shown its work. And especially look at the chronic liver disease or a kidney disease, or even the patients who are post-transplant therapy, immunomodulators, say like cyclosporin therapy or cycloserine therapy in organ transplant patients with influenza injury. There, probably L-carnitine has got a beautiful role to protect kidneys when the cyclosporin A-induced nephropathy pops in sometimes. In obese patients, in diabetic patients, in thyroid disorder patients, all these patients are going to benefit. Even for wound healing, it is necessary. Even in sepsis, it is necessary. Whenever you are recovering from acute trauma, it is necessary. In the patients, those who have got any kind of malnutrition or wherever there is a high insulin resistance, because if you remember, we talked about the action through the PPAR receptors. PPAR has got an additional benefit of altering that messenger RNA, because we all know that PPAR gamma actually forms a new messenger RNA for the better metabolism of the glucose handling and the insulin handling happens, and it reduces down the peripheral insulin resistance. How beautiful at the adipocyte level, isn't it? So all these things, the L-carnitine can be very, very beneficial, extremely beneficial.
Sir, Dr. Mosir from Srinagar in Jammu and Kashmir wants to know, and I think a very relevant question again, that can a patient of IBS, irritable bowel syndrome, take L-carnitine?
See, honestly speaking, I would like to love and find out, even though there is no documented data, but remember that, are you talking about IBS is irritable bowel or inflammatory bowel? Because two distinct entities.
I think you're asking me IBS.
So if you are asking me about inflammatory bowel syndrome, possibly yes, because again that is an hyper inflammatory disease. So wherever there is an inflammation on, wherever there is a oxidative stress on, probably L-carnitine will have some role to play, and that is where probably coenzyme Q10 also plays the role. That's the reason why it is talked so much. But most importantly, you need to understand that if you're talking about irritable bowel syndrome, then probably it is more psychological counseling of the patient, which will definitely benefit along with this. As far as inflammatory bowel disease is concerned, surely L-carnitine has some data, but as far as irritable bowel syndrome, I need to check out. I am not really aware about whether there is any data specifically for that. But remember that IBS, both inflammatory as well as irritable, both are also a part of post-COVID syndrome. So it's quite possible that, being such a multisystemic affection because of the COVID, you may as well have a role to play as far as the L-carnitine use there as well.
Okay. So, Dr. Priyanka Bhatt from Himachal Pradesh wants to know, in a patient of pre-existing heart or a kidney disease, can L-carnitine be safely given?
Yes, of course. That's what I discussed about it. But remember that, again, L-carnitine gets metabolized in kidneys. Always remember that. It gets synthesized in the liver, but it gets metabolized in the kidneys. So be a little careful. But of course, in the patients of chronic kidney disease, yes, surely you can. But in the patients of acute kidney injury, probably you need to be a little more careful in this patient. It can be surely given naturally, but be watchful because the kidneys are not functioning very well, and that is the place where L-carnitine gets metabolized. Okay, and in the heart disease, yes, we already have discussed about cardiologists love it even in the post-COVID phase for the myocardial muscle recovery, for as an endothelial stabilizer to reduce down the vascular smooth muscle proliferation. Isn't it? I mean, look
Yes.
at this so beautiful effect. The effect that a lot of monoclonal antibodies we talk about, lot of JAK2, JAK3 inhibitors that we use for COVID in acute COVID phase. What they do, they are all vascular smooth muscle proliferator inhibitors. You have got a nutraceutical, which is at much lower cost, and which also has got an ability of stabilizing the endothelium along with the reduction in the vascular smooth muscle proliferation. So neovascularization stops. So that is the reason why even in diabetic patients, in diabetic neuropathy patients, in diabetic retinopathy patients, probably L-carnitine has got a role.
So Dr. Sankarnath Mondal from Kolkata in West Bengal is asking, and again, a very good question. So we've discussed the role of L-carnitine in the post-COVID, chronic COVID scenario. He's asking the role in active COVID-19 patient.
Yeah, see, remember that active COVID-19 is management of an active disease. So naturally, your baseline support has to go on, and that is the reason why probably we have advocated a lot of vitamin C, a lot of vitamin B complex. Caution: iron in an acute phase of inflammation is avoided, because remember that COVID or any other viruses usually requires iron for the better multiplication as well as the binding. So in acute COVID situation or acute inflammatory situations, any therapy which will have iron in it, please do not use it. But in a convalescence period, yes, surely. Acute COVID phase, concentrate more in managing the systemic damage and concentrate more with the organ-specific therapies. Do well there, while the patients will recover well. Simultaneously, we can keep on continuing, but they may not be very, very actively important right there during this active COVID phase. But once the patient is through that emergency period, through that active illness, really, that is the time where these nutraceuticals will be really proving extremely beneficial.
Sir, I think probably another question, maybe the last one for the evening. This is not to COVID-19 or a post-COVID syndrome. It's the role of L-carnitine in muscular dystrophy. Anything?
Yes, it has been. This is what, see, we talked about all these disorders, and whenever there is a muscular dystrophy, yes, of course, remember that, but these are all supportive therapies. They are not, I would say curative therapies. These are all supportive therapies. So that is the reason why, this muscle fatigue or chronic muscle illnesses, or what we call it as chronic fatigue syndrome, where you have got a lot of muscle pain and aches, and of course, different types of muscle dystrophies there. Probably L-carnitine might be beneficial, but naturally the treatment of cause is very important when you try to treat these patients.
Great. I think, sir, you've covered the topic exhaustively. All the questions asked, I think, in the chat box have been covered. So unless there are no more questions, I would thank you, sir, for a brilliant talk. And I think very well covering a great topic. Hats off to you, sir. A great round of applause. And I would hand it over back to Sheshan and his team for taking it further, please.
Thank you very much.
Thank you, Dr. Mangesh. Thank you, Dr. Amit. Dr. Mangesh, fantastic lecture. And Dr. Amit, the firing of the questions back to back to Dr. Mangesh, and Dr. Mangesh also tackling them. And the amount of questions coming in, it's pretty clear that the topic is very, very important, and many people have a lot of queries and doubts. So thank you very much for clearing all of them. And we look forward to more programs on the same and solving many queries. Thank you, Dr. Mangesh, and thank you, Dr. Amit. Have a great evening. Thank you all the audience for the wonderful questions. The participation certificate is now downloadable. May I request you to kindly do that on the button that's available in the portal. Thank you and have a good evening.
Thank you very much. Thank you. Thank you, Amit. Thank you, Session. And thank you, entire team Alchem. And all of them, those who are logged in today and, they have spared their Saturday evenings with us. Stay safe, stay happy. Wish you all a very happy Raksha Bandhan as well as a very happy Pongal. Bye-bye.
Thank you so much, sir. Good evening. Thank you so much.